So my name is Meaghan Elger. I'm one of the dietitians and a diabetes educator in the Diabetes Center here at St. Mike's. So I've been asked today to come to talk to you about diabetes. So I was made aware that this is a mixed crowd. So we'll have people with sort of different stages of their kidney sort of disease or diabetes, maybe no diabetes, maybe you have diabetes, or maybe there's family members who do or do not. So I sort of wanted to cover everything. So I apologize for some people. There's going to be some probably information you already know, but hopefully everybody will take a little bit of something out of this. And of course, please feel free to ask me questions throughout. It is pretty long, so I will try to move along, but stop me if you want to ask a question. And then certainly at the end, if there's something I didn't cover, hopefully I know the answer and we can chat a bit about it at the end. All right? All right, so today we're going to talk about what is diabetes, what are the risk factors, some of the symptoms, how can we prevent it, what are the complications, and how do they screen for diabetes, and then how do we manage diabetes, and then we'll of course answer some questions at the end. So in terms of what is diabetes, there are actually many types of diabetes, but generally we break it down into two types, so type 1 and type 2. For type 1 diabetes, these people produce no insulin, and it's sort of a loss of insulin production. Their pancreas completely sort of gives up over time. In type 2, we have less insulin being produced, but then we also have that people who are still producing insulin, it's not working as well. So we say that they're resistant to the insulin that their body is making. And really, if we're thinking about the majority of people with diabetes have type 2. Type 1 is quite a small population. However, both type 1 and type 2 do have high blood sugars, so a lot of the information is the same. So I mentioned before, when we're talking about diabetes, we're talking often a lot about insulin. So what is insulin? Essentially, insulin is a hormone that's secreted by the pancreas. And you can think of it like a key. So it sort of allows the sugar to move from the blood into the cells in the body, which your cells use sugar to fuel them and to make them work. Without insulin, what happens is the sugar gets trapped in the bloodstream. So you can see it's a little key. So if we think about it here, we have certainly when we're eating foods that contain carbohydrate, and we'll talk more about what is a food that contains carbohydrate, it's broken down into sugar, and that sugar goes into blood, your bloodstream. Another way you get sugar is from your liver. So your liver is always producing a little bit of sugar to keep you going, and that also is going into your bloodstream. As you can see here, we have our pancreas producing insulin. That insulin allows the sugar to move from the blood into the cell, so it helps to lower the blood sugars in the, lower the sugar in the blood. With diabetes, what happens is the pancreas starts to produce less insulin, or the insulin doesn't work as well, and then we get that sugar getting trapped in the bloodstream, and the blood sugar rises. We're thinking of signs and symptoms of diabetes. You might be thinking, how might I know, or how might I think that I have diabetes? So I took this right from the Diabetes Canada website. So these are some of the most common signs or symptoms that you may have diabetes. That being said, any one of them probably is not necessarily suggestive of diabetes, but certainly if you had more than one, or even if you have one, it's always good to sort of start the conversation with your family doctor. So we might be looking at increased thirst, so you're drinking more fluids throughout the day than you normally did, frequent urination, so you're going to the washroom more often than normal, weight gain or weight loss. You might be tired and have lack of energy, so if you think about it, if that sugar is stuck in your bloodstream and your cells aren't getting it for energy, you're sort of going to start to feel tired. It can start to affect your eyes. Again, the sugar in your eyes, so you're going to might get blurry vision. You might have frequent infections, cuts or wounds might be slow to heal. You might feel some numbness or a lack of feeling in your fingers or your toes. And for men, you may have trouble getting or maintaining an erection. So if you have any of these symptoms, always a good idea to start the conversation with your family doctor because you can get screened. In terms of risk factors, so there are certain things that make us more likely or more at risk for getting diabetes. So that might be as your age goes up, so once you're older than 40. If you have a first-degree relative with type 2 diabetes, so that's going to be your parent, your sibling, or your child, you might want to think about your risk of diabetes. If you're part of a high-risk population, so certain ethnicities actually have higher rates of diabetes, so that would be African, Arab, Asian, Hispanic, Indigenous, or South Asian. If you have a history of prediabetes, so if your doctor has ever told you your blood sugars are a little bit high or you have prediabetes, then the likelihood of getting diabetes increases. For women, if you had gestational diabetes or diabetes in your pregnancy, if you're overweight, or there are certain medications. So for example, steroids can make your body more resistant to the insulin you're producing and may cause your blood sugars to tip into that diabetic range. So you can actually check your own diabetes risk score. So I have a website here you can go to, and if you look at the back, I've printed out the website. There's little tickets, you can take it home. If you go on, it's actually quite nice. It gives you a survey. It's going to ask you a lot of questions about your gender, your age, your relatives, your ethnicity, and then it's going to give you a score. So if it tells you you have a higher risk of diabetes, again, it's time to open up that conversation with your family doctor and say, you know what, this told me that my risk of diabetes is high. What can I do, or can we check out my blood sugar levels? In terms of getting screened for diabetes, the recommendation is that everybody over 40 gets screened once every 3 years. For people who are at risk, you may actually get screened more often. For example, if you're told you have prediabetes, they may be checking your blood sugars more often. Or if you have those risk factors, they may start actually checking you sooner. Some of the ways that they screen for diabetes would be a blood test. In the blood test, they might look at your fasting blood sugar or your fasting blood glucose. So that's if you don't eat for a period of whatever it is, sort of 10 to 12 hours that they ask, and they check your blood sugar first thing in the morning. Another one would be the A1C. So that's, I'll talk about a bit more, but it's like your 3-month sort of average, what's been going on in terms of my blood sugars over the last sort of 3 months. Another option is called a 75-gram oral glucose tolerance test. And in this one, you actually drink a very bright orange sugary beverage, if anyone's done it. I just did one because I'm pregnant, and it's very sweet. You drink the drink, and then you do blood tests afterwards. So your doctor may recommend one or many of these tests to check for your diabetes. So why do we care about high blood sugars? So the reason we care is that if your blood sugars stay high for a long period of time, they're actually going to start to affect various parts of your body. So one of my colleagues used to say, wherever the blood goes, the sugar goes, and that sugar is going to stick and start to cause damage. So some of those things, and some of you may be familiar, some of these is, so it can affect the small vessels of the body. So that could be eyes, so retinopathy, nephropathy, kidney disease, neuropathy, your nerves, or erectile dysfunction, and also macrovascular disease, or disease of the larger blood vessels. And then we're thinking of heart disease, peripheral vascular disease, or a disease of the arteries that run through the rest of your body, or stroke, so in the brain. So we're going to talk just a bit about each of them and sort of what they are and how we screen for them. So what happens, so first we're going to talk about is eye damage. So this is called retinopathy. And what happens is that there's little blood vessels feeding the retina, which has a lot to do with your vision in the eyes. When these blood vessels get damaged, you can start to have decreased or blurry vision or even vision loss. The best way to prevent this from happening is going to be managing your blood sugars. And you're actually going to see a common theme is also managing your blood pressure. Also, the recommendation is that you get your eyes checked out by an eye doctor, so an ophthalmologist versus an optometrist, where they do special screening. And this is going to be once every 1 to 2 years. And this is for people who have established diabetes when we know those blood sugars are a little bit higher. Actually, some people do actually get diagnosed by an eye doctor when they do these tests because they can see that there's been sugars in the eyes as well. So kidney disease, so as we know, kidneys remove wastes from our blood and produce urine. And the same sort of thing, there are tiny little blood vessels in your kidney that are responsible for doing all the filtration. And when those become damaged, we have loss of function of our kidney and over time. And again, good blood sugar control and good blood pressure control are what we're looking for to manage and prevent kidney disease. And then we also know there are certain medications that can help to slow the progression as well. Nerve damage or neuropathy, so we're talking about nerves. It can be any of the nerves in the body, but most often we notice it first in the limbs, the hands and the feet. And what you'll find is there's often tingling, burning. You might have loss of feelings in your fingers or toes or your legs. And so this is where we're talking about feet. So really important, we talk a lot about feet when we have diabetes, because it's really important that someone is testing the nerves in your feet. Because what can happen is if you start to lose that blood flow or that feeling in your feet, you can step on something, you can get a callus, you can get a cut, and you may not even know it's there. So really important to be watching our feet and getting someone to take a look at them. You yourself, if you have diabetes, you want to be checking your feet, moisturizing. You'll find they'll get quite dry in the winter, but you want to watch out for putting cream between your toes because it gets too moist, and then you can get bacteria that can grow there. Also, so again, early detection, so we want to be making sure that we're often checking our feet, we're having someone like a doctor, and really pretty much every time you go see either a family doctor, whoever's managing your diabetes, a family doctor, could be an endocrinologist or a diabetes doctor, you could be seeing a foot specialist like a chiropodist, you want them to be testing your feet. If you have any sort of corns or calluses, we do want to get them sort of rubbed down, but again, you want to ask someone who specializes in diabetic foot care to do that, because you want to make sure they're using really clean tools and they're not going too deep or causing any damage. You want to keep your toenails trimmed, so again, you want to watch out for going for nice little pedicures. Maybe your chiropodist will do a little leg massage, I'm not sure, but you probably want to find someone who specializes again in cutting toenails for diabetics. Yes?
Like sometimes the diabetic, their big foot got fungal. It is because of the diabetes, and why?
Sorry, people.
The big foot gets fungal infection.
Fungal infections because of diabetes?
Yeah. What is the reason?
Why did they get a fungal infection? So what can happen if you have high blood sugar? So say that the infection was in some sort of cut, it means there's going to be more sugars, because if the blood's there, the sugar's there, and what can happen is those sugars can prevent healing or cause more infections. What also can happen is over time, if the blood vessels that feed into the feet are not as working as well and the blood flow's not as good, again, you're not going to have great circulation to cause healing. So those fungal infections might occur, and then they might be harder to treat as well. Yeah. So again, if that's the case, then probably getting in to see someone like a chiropodist, because they can manage it. Again, they can clean it properly and get in whatever sort of medications you might need to treat those. Yeah, when it comes to feet, you want to make sure you're treating it quickly. Another important thing is wearing protective footwear. So even when you're in a house, maybe wearing something like slippers, because again, it's very easy to step on something, and if you've got a little bit of loss of sensation, you may not realize. So you might get something stuck in your foot or end up with a cut that you don't even notice is there. And then the other thing is shoes that fit well. So if you have shoes that aren't the right sort of fit for your feet, they can be rubbing or causing calluses in certain locations as well. So a lot to think about when it comes to foot care, really important. So sexual health, so it's not often talked about, but there are nerves and blood vessels that feed the penis. So it's not uncommon for men to have either trouble achieving or maintaining an erection. So, you know, really, physicians should be, anyone who has diabetes who's male, they should be asking these questions about your sexual history. Can you get an erection? Can you maintain your erection? Because there are lots of treatments. So again, if you have diabetes and you're struggling with this, just bring it up with your family doctor or your diabetes doctor. There's lots of options for treating this. So the next we're moving into those are the microvascular complications, or the small blood vessel complications. Now we're thinking about the big ones. So really we're thinking about the buildup of plaques in the heart, as well as in the peripheral, so out in your limbs of the blood vessels. And what we're trying to prevent here is angina, heart attacks, and strokes as well. So what can we do to reduce our risk of complications or delay the progression? And we're thinking about the ADC, and it used to be just the ABCDEs. Now they've added lots of S's. So we're thinking A1C, blood sugar control and monitoring, blood pressure, cholesterol, drugs or medications for diabetes, exercise, eating healthy, smoking cessation, screening for complications, and getting support to manage your self-manage your diabetes. So we'll talk just a little bit about each of them. So what is the A1C? So I mentioned that the A1C is used as a screening test, but it's also used to sort of assess how you're managing your diabetes. So how's it going? Do you need new medications? Is there something we need to think about changing in order to get your blood sugars well managed, again, to prevent and lower the risk of complications? So once you have diabetes, it's usually tested every 3 to 6 months. We don't do it usually less than 3 months because it's really, it sort of encapsulates that sort of 3-month period, or it's sort of looking back sort of 3 months and looking at how much sugar has been in the blood. So it doesn't make sense to do it more often. One thing to keep in mind is that when you have kidney disease, sometimes the A1C is low, but if you're testing your blood sugars, the blood sugars will be higher. Do you have a question?
A1C tested. Do you have to fast?
No. Oftentimes when you have the blood work done, you are fasting because they're testing like you're fasting lipids and cholesterol, or you're fasting blood sugar. But for an A1C, you technically do not if you're just doing an A1C. Mm-hmm. So important to keep in mind that if you have kidney disease, if the A1C seems really low, but when you're testing your blood sugars, they seem high, we actually want to rely more on those self-monitoring blood sugars, or there are some other blood tests they can do to assess your blood sugar control that aren't the A1C and more representative. The reason this happens, I'll get your question in 2 seconds. So the reason this happens is oftentimes we have the hemoglobin. The A1C is really tightly connected to the hemoglobin, and in kidney disease sometimes our hemoglobin goes down, and so the A1C goes down as well. That's one of the reasons. Yes? That's interesting. So there are lots of things that can affect our blood sugars. Sometimes infections, medications, what we ate, other things going off. Yeah, so I mean it's kind of...
I was surprised. I was okay sitting with my kid, and then suddenly I got up and then I see bloody everywhere.
Yeah. So I mean, you really did experience all the symptoms of a high blood sugar. So I mean, I certainly can't explain it, but I think the important thing is just to keep following with your family doctor, to keep checking your blood sugars at regular intervals. It's never tipped up again. Okay, well that's good news at least.
My blood sugar is normal.
Yeah, well I'm glad to hear that you checked it out. I mean, that's all you can do, right, is ask the question, and then sometimes we can't necessarily explain it because whatever caused it has disappeared. But I would just say, yeah, it sounds like you've kept on it and keep checking. And you know the symptoms now, so if you had those symptoms, certainly over a longer period of time, you'd know that that could be what's causing it. Yeah. So in terms of testing our blood sugars, so on your own, you can get what's called a glucometer or a blood sugar meter, and you could test your blood sugars. So if we don't have diabetes, we're probably not testing. If we have pre-diabetes, we could be testing. If we have diabetes, we're likely testing at some sort of frequency. The reason we want to be testing, one is it's information. It lets us know, it lets us check in, how are my blood sugars doing? How did it respond to a certain food or a type of activity, stress, like I said, illness or infection or medication. So it can kind of help us to keep a tabs on our blood sugar levels. Now, like I said, how often you're going to test your blood sugars is going to depend. So it depends on what type of medications you're on, depends on what your sort of interest is. So if you're just on pills that don't increase your risk of low blood sugars, you may not even be testing very often. Unless you're maybe making changes. Say, for example, you've started exercising more. You kind of want to know, well, what's that doing for my blood sugars? If you're on medications that increase your risk of low blood sugars, you might be checking a little bit more. If you're on insulin once a day, you might be testing once or twice a day. If you could be on insulin 2 to 4 times a day, so you might be testing 3 or 4 or more times a day. So the frequency is something you're going to decide with your doctor, your diabetes educator, a nurse or dietitian, or again for your own personal need. But certainly it can be really helpful for you to check in and get that information or that data to let you know, how are my blood sugars doing? So keep in mind, and I'd say for this whole presentation, all of this needs to be individualized to you. So I don't know anything about your medical history or what's going on in your life and your health. So if you're going to incorporate something new or make any changes, please talk to your doctor first. Same thing for targets, but just as an idea, when someone has diabetes and we talk about sort of managing the blood sugars well, if we're testing a fasting blood sugar, so that's either first thing in the morning or before we eat, we're usually looking for something between 4 and 7. 2 hours after a meal, it might go up, we know, so somewhere between 5 and 10. Again, that's going to vary based on other sort of diseases you may have, your age, your risk of low blood sugars, things like that. But this is sort of a general guideline to let you know. Mm-hmm.
Yeah, I have a question. Like my dad, he's weak, like.
So does he take like medications or insulin?
Yeah.
So it could be excuse me, about the mix, the sort of the match between the food and the medication that can cause that. We sort of want to personalize that. So probably a good idea to talk to the doctor about that. And there are different medications that can affect the fasting sugar versus the 2-hour or the after meal blood sugars. So it might just not be the right mix for him right now. If the fasting's high, maybe there's something that needs to change to bring down the fasting, but not bring down the after meal one. Yeah, so again, it could be the mixture. Yeah. But good question. So interesting, he knows that because he's testing, right? So he can say to himself, this seems a little bit high, this seems a little bit low, something needs to change.
Yeah, his
right?
doctor told him that because he told him that not to fast. But you know, being an old person,
Oh,
he
yeah.
doesn't listen and he fasts and then the cycle goes.
Well, I mean, I think we have to respect people's right to fast if they want, right? Because that is, but they maybe need a change in their medications to allow them to fast safely. Yeah, no, for sure. So I talked about low blood sugar. So there are certain pills and then of course insulin that increase our risk of low blood sugars or hypoglycemia. So that's another time, certainly if you're on those medications, you want to make sure you're testing to see if your blood sugar is less than 4. So some reasons you might feel that your blood sugar could be low is you might be sort of shaky, sweaty, hungry, tired, dizzy, anxious. They talk about headaches, that sort of thing. If you feel off and you know you're on a medication that increases your risk of blood sugars, always best to just take a check and see what it is. The thing about it is that the symptoms you get when your blood sugars are low can actually be caused by something else. For example, being chased by a bear. So I always say first check for bears. If there's no bears, check your blood sugar because it could be low. But it's that same sort of stress response that's causing these symptoms. So there's lots of other reasons. I had a woman who thought she was having a lot of low blood sugars. Turns out menopause was coming. So it can be hard. So I always say just check in with your blood sugars. That'll let you know. So some of the reasons that your blood sugar could go low is that there are certain medications that can lower your blood sugar. You could be taking too much insulin, so sometimes things change in our life. It could be the kidney function changes and you need less insulin. It could be that you've lost weight or you're more active and we need to adjust, or maybe you're eating less, so we need to make adjustments to your medications or your insulin. Exercise, so we know if we're working out, we're burning sugars, so that's bringing the blood sugars down. If you skip a meal or if your certain insulins require you to eat at sort of precise times, which is not necessarily optimal, but we've got to make sure if that's what the insulin we're on that we're eating to match that. Low carbs, so if you sort of decide, oh, I'm just going to eat a salad for lunch, but you still take your insulin, blood sugar may go low. And as well, alcohol. Pardon me?
How does alcohol?
Alcohol? Yeah, absolutely. So alcohol, when you ingest it, is broken down by the liver. But the liver is also responsible for producing a little bit of sugar all day long. But when your body has alcohol in it, your liver decides, okay, I'm first going to break down this alcohol and I'm going to forget about producing that sugar for now. But you may already have, for example, a background insulin on board, assuming that your liver is producing that sugar. So you've got no sugar, but you've got insulin, and the blood sugars start to sort of dip down. So you can see this effect sort of a few hours later. It doesn't necessarily plummet. It can sort of occur gradually over time. Mm-hmm.
Okay, it is in term, after eating anything, you feel like to sleep.
So I'm not sure I can totally say the mechanism on that. I feel like if I weren't standing here right now, I could probably come up with something creative. But with everybody watching me, I can't quite think of something. But for sure, if your blood sugar was high after a meal, you might feel lethargic because the blood sugars are high and the insulin is, your body's having trouble getting the blood sugars down. So you might feel tired and lethargic. That being said, I don't think that if you're tired and lethargic, that you necessarily have diabetes. I'm sorry, I can't explain that one. Yeah.
I have a question. Okay, you're diabetic. Okay, you're managing what you're supposed to be managing what you're eating. So let's say you've gone without eating, but yet still your sugars are low.
Okay.
Because you would think it should be normal, not really. No, not low. It's high.
Okay.
It's high. Not
Yep.
low.
Mm-hmm.
And you haven't.
But you haven't
anything
eaten.
for several hours.
Yep. Why
So
is that?
makes then, so that means the liver has been, because you haven't eaten anything.
Yep.
The liver is
Pumping out that
producing,
sugar.
That's why that gives
Yep.
you the high.
Absolutely.
Okay.
Yep.
Is that a good high or a bad high?
All highs are not good. So, but if the pancreas is working well, it's also trying to keep up with the sugar that the liver is producing. If it's not, then hopefully you've got a diabetes medication that can tell the liver, please slow down in times when you're fasting. You don't need to produce so much sugar, or that can help you produce more insulin, or maybe you're taking insulin, and this can all address the liver so that you could actually go a period of fasting. Like I was saying, if your father wanted to fast, he should be allowed to, but we may have to adjust medications because some medications count on sugar being fed to the body. And alcohol. So if anybody does have diabetes and they're having a lot of low blood sugars, please talk to your doctor. We want it to happen. We know it's going to happen sometimes because life is variable, activity comes, food doesn't arrive. But if it's happening frequently, maybe once or twice a week, you probably want to ask the doctor about if changes need to be made.
Okay, it is said that stress is one of the big factor for causing the diabetes. Is it true or it is just like?
So I don't know about necessarily chronic stress, but we do know that some people acutely, when their body gets stressed, they start to produce that cortisol, that stress hormone, and that can in the moment make you more resistant. If you truly had a physiological or like a body response of constantly producing more cortisol, then potentially that would make your blood sugars higher. So for example, steroids, when we give someone steroids, that's like creating a stress in the body. That can cause the blood sugars to have diabetes. But I don't think that general lifetime stress necessarily. So I taught another class today about cholesterol, and someone asked about, what about my stress on my cholesterol? I think let's just all lower our stress. That's the best. Yeah. So yoga, meditation. What do you think, Carmen? You probably have some good tips on lowering stress. We do got to find our ways to.
Self-management workshops.
Yeah.
Fall,
There you go. There's a plug. There'll be handouts on the back table for Carmen's class. Yeah, I don't think I certainly truly don't understand the effects of stress overall in a chronic sense or a long-term sense on the body. But I think so, yeah. If there's anything you can do to lower your stress, try to find a way. Sleep more, less stress. So managing low blood sugar. So if your blood sugar is less than 4, we need to have sugar right away. So your sandwiches, the bread, it's going to turn into sugar and raise your blood sugar, but that's not what we want when your blood sugar is low, because it takes time for your body to break it down. We want to stop that response right away, so we want to give it sugar. So there's things like Dex-4 tablets, sugar, syrup, honey, lifesavers, rockets, pop juice, and there's some handouts in the back about how to treat low blood sugars and how much to use depending on how low your blood sugar is. Did someone say chocolate? So chocolate, again, technically will raise your blood sugars, but because there's fat in it, it actually can be slowed down. In a pinch, it probably will work, but I think it's better to have something like a sugar tablet on you at all time, or something like rockets, so 2 packets. Anybody know those little rocket candies you get at Halloween that the kids don't eat? So 2 of those can treat a low blood sugar as well. So having something like that stashed in your purse or something is a good idea. So again, another way of looking at it is the rule of 15. So take 15 grams of sugar, wait 15 minutes. If the blood sugar is up over 4, you're good to go. If you take insulin, you have to think, when did I last give myself insulin? So if you took rapid acting insulin within 4 hours, you're going to need more sugar because the blood sugar is going to keep dropping. And then probably have a bit of a snack or your next meal if it's coming up soon. So. And the other thing is, so treat with some carbohydrate, not too much. That's why I like knowing a portion. So another option is like little juice boxes. It's about 20 grams often in a little kid juice box of sugar. So that's a nice portion instead of having a jug where you may pour a nice 2 cups or so of juice, and then the blood sugar will go up, but it's going to go way up. So it's nice to have a bit of sugar, get it back up, but not so much that it jumps way up. Make sure you recheck your blood sugars. And make sure that it does go back up, and then maybe check a little bit more over the next little while, again, to make sure it doesn't drop back down. So driving and low blood sugar is really important if you're on insulin or something called a sulfonylurea or something like a diamicron. You want to make sure that you're testing before you drive, and you want to make sure your blood sugar is above 5 to drive. So between 4 and 5, you're not technically low, but you're too low to drive. So you're going to want to have a snack. And then if you are low before you hop in the car, you want to treat it and wait about 45 minutes. So you're going to feel better. Your blood sugar is going to look better, but they've done studies and it turns out your sort of capacity to think and reason and drive is still too low for another 45 minutes while the body sort of reestablishes itself after that sort of response that it had. Blood pressure. So another way that we prevent the risk of complications, as I said, is a common theme that you heard, is that you want to make sure you are keeping your blood sugar your blood pressure well managed as well. So the doctor is going to check it at all your appointments, and we're looking for something around 130 over 80 or less. And if it's not that, then the doctor is likely going to suggest some medications or maybe dietary strategies to help lower it. Cholesterol as well. So again, if we're thinking about managing and preventing heart disease, we've got to talk about cholesterol. We want our LDL or our bad cholesterol to be less than 2. We want our HDL or our good cholesterol to be more than 1. We want our triglycerides less than 1.5. And then we want that ratio between the total cholesterol and the HDL to be less than 4. And you know, it's for all of these, a lot of these things are just tests that your doctor's doing. It's important. Ask your doctor, did you test my blood pressure? What was it? What do you want to do about that? Are you happy with that number? What's my cholesterol? Get curious and be involved in the management of your diabetes because in the end, you really have to make sure you're the one advocating for your own health, right? So what was my LDL? What's my HDL? What are we going to do about it if it's high? So A, B, C, D. D is for drugs or medications to manage diabetes. And there are both pills or oral forms of medications as well as injectable medications. Some of them include metformin, something called a DPP-4 inhibitor, an SGLT2 inhibitor, an insulin secretagogue, and a GLP-1 receptor agonist. You can see some of the medication names there. I won't go into them because, again, they're very personalized and it sort of depends on your kidney function as well. Some of these medications are not to be used as your kidney function goes down. Oftentimes we're switching over to something like insulin, which we know we can use at all levels of kidney function. Mm-hmm.
If we are going to take oral tablets for a long time, like if you are diabetic and you are taking oral tablets for a long time, does it affect the kidney?
Does it affect the kidney? I think in the end, for the most part, if it's taken appropriately with an appropriate kidney function, it's not going to. I mean, some of them may have side effects, but we're really trying to prevent kidney disease here. So a lot of these medications are helping to lower the blood sugars, and lowering the blood sugars are going to protect the kidneys. So whether they have side effects or some effect on the kidneys, that would be a better question for a pharmacist. But generally, I think really we're trying to protect the kidneys, right? So I think they're usually doing good things for us. So when we're talking about insulin, so people with type 1 diabetes, their only option is to manage with insulin. People with type 2 often need insulin as well for various reasons. One would be it's probably one of our most powerful tools for lowering the blood sugars. Another is that it's safe at all levels, for example, of kidney function. So it's really one of our great tools for managing diabetes. And over time, sometimes with type 2 diabetes, the body just starts producing, the pancreas gets tired, it starts producing less insulin, in which case we just need to help it out and supplement a bit. So there's lots of reasons someone on type 2 may be on insulin. They may be on insulin from day one, or it may be something they do later on in their sort of history with diabetes. There are a lot of different types of insulin. These are just a couple of them. These are our sort of rapid acting or sort of our mealtime insulins and our long acting insulins. We also have insulins that work for sort of medium periods of time. We have insulins that are mixed that have a mealtime and a long acting component. So you can be taking anywhere between 1 and 4 injections per day. So the next I'm going to talk about a little bit about diet. And again, I will make the caveat that when it comes to managing our diabetes diet, actually the kidney diet is much more important. So we want to think about the potassium and the phosphorus first, and then if it works out that some of the suggestions that we have for diabetes work for you as well, and your sort of kidney dietitian could help you figure that out, then that's great. But there's lots of things we can look at. So we can talk about maintaining a healthy weight. We can think about the quantity or the amount of carbohydrate we're eating. And really, in the end, the amount is probably more important than the type of carbohydrate. But then we can also talk about the quality or what type of carbohydrates we're eating. So when we talk about carbohydrates, what are they? So our food is made up of carbohydrate, protein, and fat. And it's carbohydrates that are broken down and turn into sugar when we eat them. So those are the ones that are actually affecting our blood sugars. So when you eat something that contains carbohydrates, so for example, the bread that we ate today, it's sort of like I think of it like a string of pearls, and each little bead is a sugar molecule. So your body breaks it down, and those sugar molecules go into the blood. Within 5 minutes, you're going to see the blood sugars start to go up. By about 90 minutes, all things else being equal, you're going to see it peak. There are certain things that might change that, depending on some sort of carbohydrates turn into sugar a little bit more slowly, some of them a little bit more fast, or if you're eating a high protein or high fat meal, again, that might sort of slow it down, but generally you're going to see it come up at about 5 minutes and peak at about an hour and a half. So carbohydrate is made up of 3 things. Sugar, so plain old sugar molecules, that's a carbohydrate. Starch, so those are those complex sort of strings of pearls I mentioned. So something like a bread, pasta, rice, those are sort of our complex starches. And then fiber. So sugar raises our blood sugar very quickly because there's no processing needed in our body. It can go right into the bloodstream. Carbohydrates raise our blood sugar a little bit more slowly because they have to be broken down first. And fiber doesn't actually break down in our body, so it doesn't raise our blood sugar. So we don't even need to worry about the fiber. So which foods contain carbs? So we kind of break it down into 4 categories. We have our grains and starches, which are going to be things like probably the ones you think about most. So bread, pasta, cereal, rice, potatoes, legumes, so beans, chickpeas, lentils, things like that. Our fruits, and then some of our sweet vegetables, so things like carrots, peas, squash, beets. Dairy, so milk, yogurt, and some soy milks as well. Sweets, so juice, pop, and sugar. So then, if I mentioned that the rest of our food is made up then of our proteins and our fat, so any food that is just made up of protein and fat is going to have minimal impact on our blood sugar. So our meats, our fish, cheese, tofu, Greek yogurt, so if it's plain Greek yogurt, it's got really low sugar. Our fats and oils, as well as things like butter, nuts, minimal impact on our blood sugars. Most veggies are free, so if they're not starchy, like zucchini, onions, peppers, okra, all those sorts of things, not going to raise our blood sugars. And then our free foods, so all of your herbs, your spices, your coffee and tea before you put in the sugar, vinegar, that sort of thing. So the amount of carbohydrate is a really important factor on that sort of roller coaster of our blood sugars throughout the day. So, and I would argue probably one of the biggest factors. So if we're having a huge portion of carbohydrates, our blood sugars are going to go high. If we can have a smaller amount and sort of spread it out throughout the day, we're going to sort of see those lower peaks in our blood sugars. So how can we actually figure out how much carbohydrate is in our food? So of course we can Google. There's the internet, apps on our phone, but we can also just use a nutrition label for any sort of packaged foods. So when you're looking at a nutrition label, the first thing you want to look at is the serving size. I always say it's not always intuitive. I was in a class actually and we were looking and someone had like a bottle of pop and the nutrition information was for like not quite, like a little more than half. We're all like, that doesn't make sense. Like you're gonna drink the whole thing. You kind of want to know what it is for the whole thing. So you kind of got to think critically, what am I actually going to eat versus what is the serving size? The next thing you want to look at is the total carbohydrate, and then keep in mind that the total carbohydrate includes sugars, starches, and fibers, but we said fiber doesn't raise our blood sugar, so we actually want to subtract that off, and what you're left with is the net carbohydrate, and that's what's actually going to raise your blood sugar. So in this instance, there's 24 grams in a third of a cup, but there's 13 grams of fiber. So, okay, 24, all of a sudden we're down to 24 subtract 13 is 11. Actually, only 11 grams of carb for this item because the fiber doesn't affect our blood sugars. So the big question, and sadly I won't be answering it for you today, is how much carbohydrate should I eat? So everybody is different. Again, it depends on what medications you're taking. So we talked about there are certain insulins where you have to eat. So you're going to have carbohydrates at all your meals. What are your blood sugars after your meals? So if you have 2 cups of pasta and your blood sugar is 20 after your meal, maybe you want to have a little bit less. Maybe you have a cup of pasta and it ends up as 10. So that's perfect. What are your goals? Do you want to lose weight? So maybe if your goal is to lose weight, you might want to cut back a little bit on the carbohydrates. What are you currently eating? So I'm not going to, if you're currently eating 4 cups of rice at all your meals, I'm not going to tell you to have a third of a cup of rice at all your meals. That's not going to be sort of popular. It's a suggestion. Or what's achievable for you, or what are your goals? So you can certainly talk to a dietitian or a doctor. If you have diabetes, there's a lot of community diabetes programs where you can access dietitians, or if you're seeing someone here, the nephrology dietitians can all sort of help you to decide that. What I will say is that one way to think about it is that really the way we distribute our food on our plate is important. So more often than not, most of our plate ends up being the starch. It becomes like the base of our meal. But really, our starch should be a side dish. Make those veggies, those non-starchy veggies, half of your plate, a quarter protein, and a quarter starch. And that can be a good way to sort of help guide how much you should have or help you sort of reduce it a little bit. So I also mentioned the quality of the carbohydrates. So some carbohydrates are going to raise your blood sugar really quickly, some a little bit more slowly. And one way we can look at that is something called the glycemic index. So a high glycemic index or a high GI food is going to turn into sugar really fast, and a low GI or glycemic index food is going to turn into sugar a little bit more slowly. So the example might be high GI would be something like white bread. Low GI might be something like beans, chickpeas, and lentils. So what I said before too is when we think about the diabetes and the suggestions for managing your diet for diabetes and those for kidney disease, we want to choose the kidney disease first. So a lot of foods that are lower or low on the glycemic index are high in potassium and high in phosphorus. So here are a couple examples that I sort of pulled from the lower potassium food items that are a little bit lower in the glycemic index. So one thing you could do is choose for your bread something like a sourdough or a light rye instead of a white bread, which is often recommended on the kidney diet. Grains, you could choose something like a parboiled rice or barley and bulgur, which are sort of heartier grains. When it comes to fruits, you can choose things like apples, pears, peaches, plums, and prunes versus some of those more tropical fruits which are going to turn into sugar more quickly. But again, if you're going to think about making changes to your food, talk to your dietitian, especially if you've been told you have high potassium or high phosphorus. All right, so the next thing we'll go into is activity. And so we know there are lots of benefits of physical activity. We already mentioned stress. So physical activity is a great way to help reduce stress for some people. For some people, it's an added stress. But if you can find an activity that is your escape, it's your oasis where you just get out and you go, whether it's walking, biking, swimming, yoga, physical activity can help to reduce stress. We know it's going to help with our heart health. It's going to help lower our weight. We also know that it makes us more insulin sensitive. So it means that the insulin you're producing or the insulin you're taking is going to be used better in your body. And then it also it itself burns sugar, so it helps to bring down our blood sugars. So how much? So first of all, we want to make sure we're fit and ready for physical activity. So always good to check in with your doctor and make sure you're ready to go. But then the recommendation is to get about 150 minutes throughout the week, and you want to try to do that without going more than 3 days doing nothing. The other thing to keep in mind is that we don't have to do it in 2-hour chunks or hour-long chunks. 10 minutes at a time is enough. And you want this to be a combination of vigorous or moderate aerobic activity, so like cardio activity, but you also want to make sure you're working on building muscle, because muscle itself is constantly burning. So if we can get nice and jacked and bulked up, that can be beneficial as well. But it also helps with flexibility and bone health and stability over time. So aerobic activities, as I mentioned, anywhere from light to moderate to vigorous activities. So again, thinking about how much are we sort of huffing and puffing when you're going out. And then it's really working out those big muscles in the body, including your heart and your lungs. And then resistance training, so anything where you're working against some sort of force. It can be your own body weight, it can be bands, it can be like dumbbells, things like that. Again, to build muscle, because muscle in itself can help us to sort of burn energy when we're just sitting still if we build up enough of it. So thinking about physical activity, as I mentioned, it can be an added stress to try to find time. So what you do want to do is start slow, start low, set tiny little goals. I will go for a 10-minute walk today. Maybe I'll go for 10 minutes 3 times a week. Also, it's important to, I read this book called The Power of Habit by Charles Duhigg, and he talks about building new habits. You really want to have a cue. So you want to say to yourself, after I X, I will exercise. So after I eat breakfast in the morning, after I don't know, brush my teeth. You want to choose something that you do on a regular basis and tie your activity to that, because then what happens is that you sit down, you eat your breakfast, and then you sort of naturally know, okay, the next thing I'm going to do, you don't have to think about it, you don't have to decide if you want to, is you head out and do your activity. Another option would be to getting a friend, family member, spouse to come with you. Chatting can be a great way to pass the time. Make sure you're both not chatting too easily or you're not going fast enough. A little bit of pause every so often is good. And then break it into small parts, like I said. So it can be 10 minutes. You can do 10 minutes a day. You could do 10 minutes 3 times a day. You can sort of figure out what works for you. So I also mentioned weight. So we know that losing weight can improve our blood pressure, our cholesterol, brings down our A1C. It can allow our body to be more sensitive to the insulin that we produce. And again, it can also help with wellness, sleep, and reduction in stress. So weight loss strategies that work. So there are many different diets and many different ways you can go at weight loss. And the studies have really said, generally, they're all going to work if they work for you. So when we think about the types of foods we're eating or the amounts of foods we're eating, I think that's something you have to sort of personalize and think about for yourself. What works for you, what's going to be sustainable, what's safe, what matches with what your dietitian is saying. But when we think of habits related to weight loss, things like writing down what you're eating throughout the day can be helpful, because oftentimes it's not what you do at the major meals or at the regular meals in your day. It's those extra things here or there that sort of sneak in. And if you're writing them down, it kind of keeps you accountable or sort of gives you that sort of eye-opening, I do have an extra snack every night. Maybe I don't need that or something like that. You can write down food journals by hand, or there's lots of apps as well that can help with tracking intake as if you're sort of tech savvy. Avoiding evening snacking. So this can be a time when we may not need something extra and it just sort of ends our day with a few extra calories. So maybe that's something to think about. Maybe if we're hungry in the evening, moving your dinner a little bit later or making sure there's sufficient like fiber and protein at our dinner so that we're not hungry in the evening. More eating either meals made from home or brought from home. When you're out at restaurants, we certainly know they're more in it for the flavor. They're not necessarily looking out for your health. So better if you can know what's in the food and what you're choosing. The other thing is, it's about planning. So if you say to yourself, this is what I'm eating tomorrow, you're probably going to be more successful than if you set out in the day being like, what do I feel like eating today? Okay. So this is our last slide. So when we're thinking about managing diabetes, as you can see, it's been like an hour and some of content. So there's lots of things to think about. It can be overwhelming. First of all, find support, whether it be through your family doctor, a community program, a dietitian, a diabetes center, because you can work with the team there. It is manageable when you have someone on your side to support you and sort of guide you. The next thing is to break it down into small steps. Think about making small goals. And so one technique that you can use is called the SMART format for a goal. So you want it to be specific. So choose, I'm going to eat more vegetables or something like that. It may not be that specific, but it's at dinner, I will eat half of my plate will be vegetables, or I will have 2 cups of vegetables. Make it attainable. So like I was saying, if you're eating 4 or 5 cups of rice at all your meals, you're not going to cut it down to 1/4 cup. Maybe if you say, I'm just going to cut off 1/4 cup, I have 1/4 cup less rice, pasta, bread, whatever it is, that might be more attainable and more realistic. And the next is timely. So give yourself a period of time in which you're going to check in with yourself. So by January, I want to be eating 2 cups of non-starchy vegetables at all of my dinners. Seems silly, seems small, but I think that's something you can, if the goal is small enough, you're going to be able to find the motivation, and it's something that's going to be sustainable. All right, well, I will be circling around for the next little bit, so happy to chat more with anybody one-on-one if you'd like as well. All right, great. Thank you so much, everybody.